Have you ever felt that little wave of worry when you hear the words brain infection and your mind immediately jumps to the worst-case scenario? One of my patients once shared that she saw the word brain in a headline and felt her stomach drop before she even read the rest. I want you to imagine this. You are sitting across from me in a quiet exam room, and you ask a question that sounds simple but carries a lot of fear. Is my brain at risk? I am Dr. Evelyn Carter, and for decades I have cared for older adults and the families who love them. When we talk about the brain, we are talking about memory, personality, independence, and the little moments that make life feel like yours. So when a title includes the words Nipah virus and brain infection, it can feel heavy before we even begin. Here's the reassurance I want to offer right away. Learning about this topic is not meant to scare you. It is meant to give you steadiness. Nipah virus is a rare virus that scientists study carefully, and it is sometimes discussed in neurological research because, in certain cases, it can affect the nervous system. That does not mean it is a daily threat. It means researchers and public health teams pay attention so they can stay prepared and protect people if needed. In real clinical life, I have seen how fear grows when information arrives without context. A patient reads a few words, then fills in the blanks with worry. But medicine is not built on blanks. It is built on evidence, patterns, and careful explanation. When older patients ask me, "Is my brain at risk?" I slow everything down and we look at what the science actually shows and what it does not. This video is for seniors and caregivers who want clear answers without panic. We will move gently, use plain language, and keep our feet on solid ground. In the next part, we will walk through what really happens in the brain during Nipah infection, what symptoms researchers have observed, and why most daily routines remain safe and steady. If you appreciate calm, science-based guidance like this, please subscribe to Senior Health Daily, tap like, and share this video with someone you care about. Your support helps us keep creating thoughtful, trustworthy health content made especially for you. What science knows about Nipah virus and the brain. When science looks at how a virus may affect the brain, it does so slowly and carefully. Researchers do not begin with conclusions. They begin with questions. They observe patients, study patterns, review imaging, and compare findings across time and place. This approach matters because the brain is complex, and small differences in symptoms can lead to very different explanations. With Nipah virus, what science knows comes from a limited number of documented cases, laboratory research, and careful follow-up. Doctors noticed that some patients developed neurological symptoms during severe illness, and that observation prompted deeper study. From there, researchers asked how the virus might interact with the nervous system and under what circumstances that interaction occurs. This is how medical knowledge grows step by step, without urgency or drama. It is important to understand that research data and media interpretation are not the same thing. Research speaks in careful language. It describes what was observed, in whom, and under what conditions. Media stories often compress this information into simplified phrases that can sound alarming. A study that notes brain involvement in a small group of very ill patients may become a headline that feels broad and threatening. The science itself has not changed, but the framing has. In my clinical experience, this gap between data and interpretation is where fear often enters. A patient reads a headline and imagines a risk that applies to everyone. Science rarely works that way. Findings related to Nipah virus and the brain are tied to specific contexts, including severity of illness and timing of symptoms. They do not describe what happens in ordinary life or to most people. Another key point is that scientific studies aim to understand mechanisms, not to predict outcomes for individuals. When researchers examine brain tissue or neurological signs, they are learning how the body responds under stress. This knowledge helps doctors recognize symptoms early and provide appropriate care. It does not mean those outcomes are expected or common. I often remind my patients that attention from science is a form of protection. When a virus is studied closely, it means systems are learning how to respond thoughtfully. It does not mean danger is spreading unnoticed. The quiet nature of research reflects caution and responsibility. Understanding what science actually knows allows you to listen without fear. It places information in the right frame. Knowledge becomes a tool for clarity rather than a source of worry. As we continue, keep this perspective close. Science is not telling a story of inevitability. It is telling a story of careful observation, limited findings, and ongoing learning grounded in evidence and care. How the virus reaches the brain. When people hear that a virus can affect the brain, the first question is often how it gets there. This is a natural concern, especially for older adults who understand how precious brain health is. The answer, however, is far more specific and limited than many people imagine. In simple terms, the brain is well protected. It is surrounded by layers of defense, including the skull and a protective barrier that carefully controls what enters brain tissue. Most viruses never reach this area at all. When scientists study Nipah virus and the brain, they are examining rare situations in which the body is already under severe stress. In documented cases, the virus affects the nervous system only after it has caused serious illness elsewhere in the body. This is not a quick or easy process. It involves a chain of events that includes intense infection, inflammation, and a weakened ability of the body to contain the virus. Only under these conditions does the virus have an opportunity to interact with the nervous system. Researchers believe that in severe cases, the virus may reach the brain through the bloodstream or along nerve pathways. These routes are not open highways. They require time, high viral levels, and specific biological circumstances. This is why neurological involvement has been observed primarily in patients who are already critically ill, often in hospital settings where close monitoring is taking place. I want to be very clear about what this does not mean. It does not mean that everyday exposure leads to brain infection. It does not mean that mild illness progresses toward the brain. And it certainly does not mean that normal daily activities create risk. The mechanism scientists describe is a special one, not a common pathway. In my years of practice, I have seen how easily people assume that if something is possible, it must also be likely. Medicine makes an important distinction between possibility and probability. The pathway to the brain described in research is possible under extreme conditions. It is not a typical course of illness. This distinction matters because fear often comes from imagining rare mechanisms as everyday events. When patients understand that the brain is involved only in severe and uncommon situations, their anxiety softens. They realize that their own bodies, living within familiar routines, are not facing the scenario described in medical journals. Understanding how the virus reaches the brain is meant to inform doctors, not alarm patients. It helps medical teams recognize warning signs early and respond appropriately. For seniors and caregivers, this knowledge can be reassuring. It reminds you that the body has strong defenses and that the situations described in research are far removed from normal life. As we continue, keep this grounding thought with you. The science you are hearing describes what happens at the outer edges of illness, not at the center of everyday living. Brain infection versus brain damage. One of the most common sources of fear I see in my patients comes from a simple misunderstanding of medical words. The terms brain infection and brain damage are often used as if they mean the same thing, but in medicine they describe very different experiences. Understanding this difference can ease a great deal of unnecessary worry. A brain infection refers to inflammation or irritation that occurs when the immune system is responding to an illness. Inflammation is not the same as destruction. It is the body's attempt to protect itself. When inflammation involves the brain, doctors pay close attention because the brain is sensitive, but sensitivity does not automatically mean permanent harm. In many cases, inflammation can be temporary and reversible once the underlying illness is treated and the body has time to recover. Brain damage, on the other hand, describes lasting injury to brain tissue. This is a much more serious and specific outcome. It implies that cells have been harmed in a way that does not fully heal. Importantly, scientific studies involving Nipah virus do not suggest that brain damage is an expected or routine result. The research focuses on inflammation and neurological symptoms observed during severe illness, not widespread permanent injury. Many people hear the word encephalitis and immediately think of irreversible damage. Encephalitis simply means inflammation of the brain. It describes a process, not an outcome. Inflammation can range from mild to severe, and the body often recovers, especially when care is timely and supportive. The word itself sounds frightening, but its meaning is more nuanced than headlines suggest. I often sit with older patients who worry that any mention of the brain means memory loss or loss of independence. That fear is understandable. The brain holds our stories, our relationships, and our sense of self. But medical terminology is precise, and when those words are taken out of context, they can feel heavier than they truly are. Another reason confusion arises is that media summaries tend to simplify language for speed. A complex medical explanation becomes a single dramatic phrase. What was meant to describe a temporary immune response can sound like permanent damage. The intention is rarely to mislead, but the effect can be unsettling. From a clinical perspective, doctors look at the whole picture. Symptoms, timing, severity, and response to care all matter. Temporary neurological effects during severe illness do not define a person's future brain health. Recovery is a real and common part of the story, especially when the illness itself is rare and closely monitored. Understanding the difference between infection, inflammation, and damage allows you to place information where it belongs. It helps you hear medical discussions without immediately assuming the worst. Knowledge does not remove caution, but it replaces fear with perspective. As we continue this conversation, remember that words matter. When you understand what they truly mean, they lose their power to frighten and begin to serve their real purpose, which is to explain, not to alarm. Neurological symptoms in real patients. When people hear that a virus can affect the brain, they often imagine one clear set of symptoms that appears the same way in everyone. In real medical practice, that is rarely how neurological symptoms unfold. The human brain is deeply individual, shaped by age, health history, and how the body responds under stress. This is why symptoms related to Nipah virus have not appeared uniformly across patients. In documented cases where neurological involvement was observed, symptoms varied widely. Some patients experienced confusion or changes in alertness. Others had headaches, seizures, or difficulty with coordination. In a few severe situations, patients became less responsive or had trouble speaking. These symptoms were noted primarily during advanced stages of illness, often when the body was already fighting a significant infection. What is important to understand is that these symptoms did not appear all at once, nor did they follow a predictable pattern. One patient might show early neurological signs, while another with the same infection might not show them at all. This variation can feel unsettling to those reading about it, but for doctors, it is expected. The nervous system reacts differently depending on many factors, including overall health, immune response, and timing of care. I often explain to my patients that symptoms reflect how the body is coping, not just what the virus is doing. In older adults especially, factors like dehydration, fever, low oxygen levels, or medication reactions can temporarily affect thinking and awareness. These changes can look neurological, but they are often reversible once the underlying issue is addressed. Another reason symptoms differ is that the brain does not function as a single unit. Different areas control different abilities. If inflammation affects one region, symptoms may involve balance or speech. If another area is involved, attention or memory may be affected. This does not mean the entire brain is compromised. It means a specific system is under strain. Media reports sometimes list symptoms without explaining this context, which can make the situation seem more dramatic than it is. A list of neurological signs does not mean every patient experienced all of them, or that they persisted long-term. In many cases, symptoms improved as the illness resolved and supportive care continued. From a clinical standpoint, doctors monitor neurological symptoms closely because early recognition helps guide care. Monitoring does not mean expecting the worst. It means staying attentive to changes that can be managed. For seniors and caregivers, this understanding can be reassuring. Symptoms are signals, not predictions. They reflect a moment in an illness, not a permanent state. When you understand that variability is normal and recovery is common, fear gives way to perspective. The story of neurological symptoms is not one of inevitability, but of careful observation, individualized response, and the body's remarkable ability to regain balance. Encephalitis, explained in simple terms. Encephalitis is one of those medical words that can stop people in their tracks. I have seen it happen many times. A patient hears the term and immediately imagines the worst. That reaction is understandable, especially for older adults who know how central the brain is to independence and identity. My role as a doctor has often been to slow that moment down and translate what the word truly means. In simple terms, encephalitis means inflammation of the brain. Inflammation is the body's response to stress or infection. It is a signal that the immune system is active and trying to protect tissue. Inflammation does not automatically mean injury. It means the body is reacting. Just like a swollen ankle after a twist, inflammation in the brain reflects irritation, not destruction. When encephalitis is discussed in relation to Nipah virus, it refers to situations where the immune response involves the brain during severe illness. This has been observed in a limited number of patients who are already very sick. It is not something that appears suddenly in people who are otherwise well. This distinction is essential because fear often comes from imagining encephalitis as a spontaneous or common event. It is neither. Doctors become concerned when inflammation in the brain affects essential functions such as consciousness, breathing coordination, or persistent seizures. Concern is tied to severity, progression, and how the patient responds to care. Even then, concern does not equal panic. It means careful monitoring, supportive treatment, and time. Many forms of encephalitis improve as the underlying illness is treated and the immune response settles. On the other hand, doctors are not alarmed by every mention of inflammation or temporary neurological change. Mild confusion during fever, fatigue, or illness is common, especially in older adults. These changes often resolve with rest, hydration, and recovery. They do not point to ongoing brain disease. Understanding this difference can spare patients and families a great deal of distress. I often tell my patients that medicine looks at patterns, not isolated words. A diagnosis like encephalitis is not made lightly, and it is not applied broadly. It is based on symptoms, tests, and progression over time. Most people reading about it online are encountering the word far removed from the clinical reality in which it is used. For seniors and caregivers, the most important takeaway is this: encephalitis is a specific medical condition, not a general threat. It appears in rare and serious situations, under close medical supervision. It does not quietly develop in everyday life. When medical language is translated into plain understanding, its power to frighten fades. What remains is clarity. Knowing when doctors are truly concerned and when they are simply observing allows you to place information in the right context, and in that context, calm becomes possible again. Understanding risk for older adults. When we talk about risk, especially for older adults, it is important to separate what feels frightening from what science and real life actually show. I have spent many years sitting with seniors who ask thoughtful, honest questions about their health. Most of them are not looking for dramatic answers. They want to know whether something truly touches their daily lives. From a scientific standpoint, the risk of Nipah virus affecting older adults is very limited and highly specific. Risk does not come from age alone. It comes from exposure, severity of illness, and environment. The situations described in medical research involve people who are already very ill and often receiving intensive care. These are not circumstances most seniors encounter in everyday life. One of the most reassuring facts is that Nipah virus-related brain involvement has not been linked to ordinary routines. Activities like visiting family, attending appointments, shopping, walking, or enjoying community life are not associated with increased risk. There is no evidence that normal social interaction places seniors in danger. In fact, maintaining these routines supports emotional health, which in turn supports physical resilience. In my clinical experience, older adults often worry that being more vulnerable means they should withdraw or restrict their lives. Science does not support that conclusion here. The body responds best when it feels safe, steady, and supported. Fear-driven changes can create stress, disrupt sleep, and weaken overall well-being. Calm understanding protects health far better than avoidance. Caregivers also carry concern, sometimes quietly. They worry about bringing illness home or missing signs they should have seen sooner. What I want caregivers to hear is this: risk is not hidden in ordinary moments. It is tied to specific medical conditions that are monitored closely by healthcare systems. You are not expected to manage this alone or anticipate rare outcomes. Understanding risk means understanding boundaries. Knowing where risk is not allows you to live more fully, where safety already exists. That knowledge brings relief. It allows seniors to continue living with dignity and confidence rather than hesitation. At this point, I want to pause gently and speak directly to you. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. As we move forward together, remember this central truth: risk is not everywhere. It is limited, understood, and watched carefully. When you know that, fear loosens its grip, and trust has room to return. Health feels less like something to defend and more like something to live within, calmly and confidently. Brain inflammation and recovery. One of the most hopeful truths I share with my patients is that the brain has a remarkable capacity to recover. Even later in life, the brain is not a fragile, fixed organ. It is responsive, adaptive, and deeply influenced by the environment around it. When inflammation occurs during illness, it does not automatically define the future of brain health. In many cases, it marks a temporary state rather than a permanent change. Inflammation is the brain's way of responding to stress. It is part of the immune system doing its job. When the underlying illness improves and the immune response settles, inflammation often eases as well. This is why doctors focus not only on symptoms, but on the conditions that allow the brain to return to balance. Time, support, and stability matter more than dramatic interventions in most recovery paths. I have watched older patients regain clarity after periods of confusion that once felt frightening to their families. As fever lowers, hydration improves, oxygen levels stabilize, and rest is restored, the mind often follows. Recovery does not always happen all at once. It unfolds gradually, sometimes quietly. That gradual return can feel slow, but it is meaningful progress. Rest plays a central role in this process. The brain heals during rest. Sleep allows neural connections to reset and inflammation to calm. When seniors are rushed, overstimulated, or kept in a constant state of worry, recovery becomes harder. Creating an environment that feels calm and predictable gives the brain permission to heal. The sense of safety is just as important as physical care. When a person feels secure, the nervous system relaxes, stress hormones decrease, blood flow improves, and healing processes function more efficiently. I often remind caregivers that reassurance is not just emotional support, it is biological support. A gentle voice, familiar routines, and patient presence all contribute to recovery. Proper medical care also matters, but it does not always mean aggressive treatment. It means attentive monitoring, addressing underlying causes, and avoiding unnecessary disruption. In cases where brain inflammation has been part of illness, supportive care often provides the strongest foundation for improvement. Nutrition, hydration, and movement also support recovery. The brain depends on steady fuel and circulation. Simple acts like regular meals, gentle activity, and fresh air can make a meaningful difference. These are not dramatic solutions, but they are powerful ones. I have learned over the years that healing is rarely loud. It happens in quiet moments, a clearer morning, a longer conversation, a return of curiosity. These signs matter. They tell us the brain is finding its way back. For seniors and caregivers, this perspective offers reassurance. Brain inflammation does not erase resilience. With rest, safety, and thoughtful care, the brain often responds with strength. Recovery is not only possible, it is something the brain is designed to pursue when given the chance. Facts versus fear. Around brain infections, few words create more fear than brain infection. I see this reaction often, and I understand it. The brain feels personal and irreplaceable. When people read about infections involving the brain, the imagination can move faster than the facts. This is where it becomes essential to pause and separate medical evidence from common speculation. Medical facts come from documented cases, clinical observation, and careful study. They describe what has been seen, how often it occurred, and under what conditions. Fear usually begins when those facts are removed from context. A rare outcome becomes a general threat. A severe case becomes an assumed pattern. This shift happens quietly and can be very distressing, especially for older adults who value stability. With brain infections, including those discussed in relation to Nipah virus, the facts show that neurological involvement is uncommon and tied to severe illness. It is not something that develops suddenly in everyday life. Speculation, however, often ignores severity and setting. It fills in missing details with worst-case scenarios. This is how fear grows without evidence. I encourage my patients to read health information with a gentle filter. Ask simple questions. Who is this information describing? Is it about people who were already critically ill? Does it explain how often something happened, or only that it happened? Articles that focus on frequency, conditions, and limits are usually grounded in fact. Those that rely on dramatic language without explanation often are not. Another helpful guide is tone. Medical information meant to inform tends to sound measured and careful. It explains uncertainty and avoids absolute statements. Fear-driven content often feels urgent, alarming, and emotionally charged. Your body often senses this difference before your mind does. If your chest tightens or your thoughts race, it may be a sign that the information lacks balance. For seniors, protecting peace of mind is part of protecting health. Constant exposure to alarming interpretations can raise stress levels and disrupt sleep, appetite, and focus. Choosing when to engage with health news and when to step back is not avoidance. It is wise self-care. I often remind families that doctors are trained to watch for patterns, not isolated stories. A single case does not define risk. Patterns do. When you understand this, the weight of frightening headlines begins to lift. Facts do not demand panic. They invite understanding. When you learn to recognize the difference between evidence and speculation, you regain control over how information affects you. The brain thrives in calm, not fear, and calm begins with clarity. Role of medical and public health systems. Much of what protects our brains and our communities happens quietly, without headlines or urgency. Medical and public health systems are designed to work this way. Their purpose is not to alarm, but to observe, prepare, and respond with care. When it comes to neurological health and rare infections, this quiet vigilance is one of our strongest safeguards. Neurological monitoring begins at the bedside. Doctors and nurses are trained to notice subtle changes in awareness, movement, speech, or behavior. These signs are not dramatic, but they are meaningful. When a patient is ill, careful observation helps clinicians decide whether symptoms reflect temporary stress on the body or something that requires closer attention. This is how potential neurological issues are recognized early, when supportive care is most effective. Beyond individual care, public health systems connect information across hospitals, laboratories, and regions. When an unusual pattern appears, specialists review data together. They ask whether symptoms are isolated or shared, whether they are progressing or resolving, and whether there is any sign of broader risk. This coordination allows for thoughtful decisions rather than reactive ones. Many people assume that if something were truly concerning, they would hear about it immediately. In reality, the opposite is often true. When systems work well, they contain problems before they become visible. Protective protocols are adjusted, guidance is shared among professionals, and monitoring continues quietly. The absence of disruption is often a sign that prevention is working. I have seen this process from the inside. Teams meet, review findings, and refine care without drawing attention to themselves. Their goal is stability. Especially for older adults, stability supports healing and peace of mind. Public health understands that fear can cause harm even when illness does not. Another important role of these systems is education. Doctors receive updates, training, and clear guidance so they can speak calmly and accurately with patients. This reduces confusion and helps families understand what matters and what does not. When clinicians are informed, reassurance becomes possible. For seniors and caregivers, it is comforting to know that responsibility does not rest on your shoulders. You are not expected to interpret complex neurological data or track rare conditions. That work is being done by professionals who are committed to protecting the whole community. Quiet protection may not feel dramatic, but it is effective. It allows daily life to continue without interruption. It supports recovery, preserves routine, and maintains trust. When you understand that many layers of care are operating in the background, you can breathe a little easier. Health is not only about responding to illness. It is about creating conditions where illness has little room to grow. Medical and public health systems do this quietly, patiently, and with purpose, so individuals can live with confidence rather than concern. What research findings really mean. Research findings can feel overwhelming, especially when they involve the brain. I often meet patients who tell me they read a study summary online and felt uneasy for days afterward. What they were reacting to was not the science itself, but how incomplete or dramatic the information felt. Understanding what research truly means can change that experience entirely. Scientific research is designed to answer narrow questions. It does not describe what will happen to most people. It describes what was observed in a specific group, under specific conditions, at a specific moment in time. When researchers study viruses and the brain, they are often looking at rare and severe cases to understand mechanisms, not everyday outcomes. That distinction is essential. One of the most important things to notice in research language is caution. Words like may, can, and has been observed are chosen deliberately. They signal possibility, not expectation. When those words are removed or softened in public summaries, the meaning can shift dramatically. A limited observation can begin to sound like a widespread threat, even when it is not. Being informed means reading research with context. It means asking who was studied, how sick they were, and how often the finding occurred. It also means recognizing that a single study does not stand alone. Science builds understanding over time by comparing many studies and refining conclusions. Early findings are part of a conversation, not a final answer. Being alarmed is different. Alarm often comes from treating possibility as probability. It comes from imagining that what happened in a rare clinical setting applies to everyday life. This leap is understandable, but it is not supported by how science works. Alarm narrows focus and increases stress, which does not support health or clarity. In my practice, I encourage patients to notice how information makes them feel. Research that is explained responsibly often brings understanding, even when the topic is serious. Information that creates panic usually lacks balance or context. Learning to recognize that difference is a skill that protects both mental and physical well-being. For seniors, staying informed should feel empowering, not exhausting. Knowledge is meant to support confidence and decision-making. It should help you trust your routines and your body rather than question them constantly. When information leads you back to steadiness, it is doing its job. Research findings tell us that science is paying attention. They show that doctors and researchers are learning, monitoring, and preparing. They do not tell us that danger is imminent. When understood properly, research becomes reassuring rather than frightening. Being informed means you can listen without fear. It allows you to hold information gently without letting it disrupt your peace. And in that calm understanding, the brain itself is better supported. Thank you for staying with me until the very end. Your time matters, and choosing to listen with care is already a quiet act of respect for your own health. As we close, I want to return to the heart of this journey. Understanding Nipah virus brain infection is a story about balance, not fear. It is about learning enough to feel steady while allowing peace to remain present. Science, when explained with care, is meant to support calm understanding, not take it away. Over many years of caring for older adults, I have learned this truth again and again. The body and the brain respond best when they feel safe, respected, and unhurried. Healing and resilience do not come from pressure or constant vigilance. They come from trust, patience, and honoring the rhythms that have carried you through life. To caregivers who may be listening, I want to speak directly to you for a moment. Your calm presence matters more than you may realize. Your patience, your steady voice, and your willingness to sit with uncertainty are powerful forms of care. Often, the greatest support you offer is not doing more, but being present without fear. If there is one feeling I hope you carry forward, let it be reassurance. You do not need to change how you live. You do not need to hold worry in your daily moments. Knowledge can exist alongside peace. Senior Health Daily is here as a gentle place to return whenever questions arise, a place for clear information, dignity, and calm guidance. If this space has brought you understanding or comfort, I invite you to stay connected with us. Together, we will continue choosing trust, patience, and gratitude for the bodies and minds that have brought us this far.